it's my great pleasure to interview Dr. Jose Pomar, who's the immediate past president of the European Association of Cardiothoracic Surgery. Jose, it's a pleasure to have you here in this 25th meeting of the Saudi Heart Association. The relation between the Saudi Heart and the EACS goes back a few years, and you have been a great supporter for the Saudi Heart over the last few years. I'd like to hear from you about your impression about the surgical sessions and what you think about the overall of the SHA-25.
I have to say, first of all, congratulations. 25 years. I have to say that I came here to Saudi Arabia in 1987 to Jeddah, and the evolution has been outstanding. I mean, it's difficult to understand how things can evolve in this way. And concerning to the meeting, I was here last year, and this year was unbelievable. I was surprised at how packed was the room during the surgical meeting, because usually cardiologists are always
overwhelming.
It's overwhelming. But here, yesterday, was a lot of people standing up at the bottom of the rooms, so it was extremely good. And the topics, the discussions, and the level was really great. Very good. Very good.
Excellent. I know also, Jose, that you actually lead the international relation of the European Association of Cardiothoracic Surgery. And is there any prospect, like more on the cardiology societies, to have joint sessions in your European-based meeting? Is this something that you would consider in order to draw interest and more audience to the meeting?
One of the problems we have as EACTS, and you know that very well, is that we have too many meetings all over the world asking to go and to be part of the meeting. So it's very difficult. Sometimes it's very complex. But on the other hand, from time to time to come to meetings like this one, for us it's a big pleasure. It's a great opportunity to meet people. And also, as you mentioned, the possibility of having specific sessions in the annual meeting of the European Association, where to have people from different areas where they may discuss different topics. This next year, for instance, in Milan, and I have been there the last month in South America, we are going to have the Latin American societies joining for the whole afternoon of Sunday, where they are going to discuss, for instance, TAVI is something which in some countries in Europe, they feel like that's funny, that's very good, that's great, but is it worth in a South American country where the money is short and people is not having the life expectancy we may have here? Rheumatic heart disease, for instance, something in Europe you don't see that much, and this is a very important issue there. All the economical aspects of and the education of cardiothoracic sessions. So we are planning to have a specific sessions, and I would be very happy if you want to be also leading a group of people from here and organize for the next years something about that. I think it's
I think this is great because, as you said, each area has its own relevant geographic, financial, political environment that impacts the practice, as a matter of fact. And you cannot apply what happens in the States or certain countries in Europe everywhere. And this is where expertise comes in from European Association of Cardiothoracic Surgery to come in and add to these meetings.
And I think to share also data from both places, because we are planning to have we have a program which tries to optimize the collection of data from all over Europe, and not only Europe but the whole world of Europe. But today the resources you have are different, and you are able to get softwares, and that's what we are trying to do, where you have your own system here. We don't need to be linked directly your database with our database, but we can have software where we can see, for instance, the prevalence of, let's say, high cholesterol levels in your population, or the number of cardiac procedures you do in coronary patients, and to just combine those data with the others, and for your interest and our interest to know what's going on.
Jose, on a social aspect, do you like coming to Saudi Arabia?
Very much. extremely.
Well, this is
I
great to
love
hear.
the food and I love the hospitality of the people, and I really always enjoy very much.
Well, we are really delighted and privileged that you've spared the time to come to SHA 25. We look forward to further collaborations.
My
really,
pleasure.
thank you very much.
Again,
Really appreciate
congratulations.
it. Thank you very much, Jose. Thank you.